इसमें जो की इश्यूज है, ये टॉपिक हमने क्यों लिया, इसकी एक वजह है। ओल्डर एज इंक्लूड मेंटेनिंग, आपने एज यू ग्रो सोशल रोल्स हमारे कम होते जाते हैं। हम अपने हेल्थ के चैलेंजेस को अडेप्ट नहीं करना जानते। अडेप्ट मैं वर्ड कर रहा हूं। सो मुझे अगर कम सुनाई देता है, मैं आगे की जिंदगी कम सुनने के बावजूद खुश खुश कैसे बिताऊं, दैट इज इंपॉर्टेंट। बैठ के रोना नहीं है। सो द चैलेंजेस फॉर द ओल्डर पर्सन आज की तारीख में एक बहुत बड़ा चैलेंज है, टू रिमेन रेलिवेंट। अब मैं कैसे रेलिवेंट रहूं? देर आर नंबर ऑफ रिक्वायरमेंट्स। दे कैन बी साइकोलॉजिकल, दे कैन बी सोशल एंगेजमेंट, बहुत सारी चीजें हैं। अब इनके जवाब कहां से मिलेंगे आपको, और क्या करना चाहिए इसके जवाब के लिए? टू आंसर दिस क्वेश्चन, नोबडी बेटर देन an academician, a teacher, an administrator, and above all, a great human being. Please welcome my dear friend, Dr. Nimesh Desai, who was the former director of the Institute of Human Behavior and Allied Sciences. He's a great academician, a teacher, and a thinker. It is a pleasure to have you over with us, Dr. Nimesh Desai. As always, bubbling with energy. Uh, Khushbu, can you please pin him? मेरे पास वो option. Yes, that's right. Welcome, Dr. Nimesh Desai, once again to our family. And on the day of International Older Person, we welcome you as our special guest to talk about resilience और relevance. इसका भाव और इसको कैसे करें. You can share your slides.
Thanks, sir. Thank you.
तो इसको full screen कर दीजिए.
हाँ सर, कोई कर.
सारे इकट्ठी आ गई हैं स्लाइड.
हाँ जी. Good afternoon, Bobby, my friend, all of you. I've been with you more than I think a couple of times, and Dr. Grewal has been very kind in saying what he has said. It occurred to me today particularly that actually it's true for all the occasions that I've joined you, but today particularly, I am joining you not only as a so-called expert, but also as, I hope this is the one. No, this is not the one. Wait a minute, sir. Give me half a minute, sorry.
Sure, sure.
मैं कहने लगा था कि हेल्थ साइंसेज में और बहुत सारे बाकी फील्ड्स में, इंक्लूडिंग gerontology, geriatric care, there has been this increasing movement of accepting two kinds of expertise, which is, one is the technical professional expertise that all of us carry in different fields, whichever field one has specialized in and worked in. And the other expertise is what is called the lived in expertise. And the lived in expertise combines very well with the so-called professional or technical expertise to bring out the best outcome for whatever is the service or the hope that one has. And so I'm here both as your co-traveler and a so-called expert, technical. I'm sure you have seen this one way or another. What occurred to me today, interestingly, excuse me a minute, I'm in a hotel room and this guy is just coming at this time. Sorry about that. I'm traveling and I'm in a guest house. Okay, so like Bobby said, we all need to be living up to 100, inshallah, inshallah, whichever way. And so I was thinking today, it's like, you have been suddenly upgraded to a first class in an international long flight, and you have had a wonderful flight till now, most large parts of it. And you now know that your flight is about to end in a couple of hours or a few hours. and yet you want to make the best of it. So that last part of a luxurious flight that we have all had
Yeah.
is now what we need to talk about.
Lovely.
Saying, yes, please. Boy, could you get it?
Carry on, please.
Hmm. So that's the two types of combination of two types of expertise that I was talking about, and amongst many good examples from oncology to mental health to many others, I guess care for the older persons is one of those best. Let's Let's begin with this. I thought we must talk about this briefly for another thing that occurred to me today. That occurred to me today, and we have spoken about this earlier, and I'm sure many of you have spoken about this at various platforms. But it occurred to me that some of us in this group and in the world of the older persons who belong to the young old must feel good to at least have the adjective prefix young. I also suspect vicariously that. At the WHO headquarters and UN, when they formulated these subgroups, those who formulated them belonged to the young old. There must not have been too many people in the group of 75 or to 85 or 85 and above, because this classification nomenclature is kind of positively inclined toward the young old still, but be that as it may. Two topics that Dr. Grewal I thought we try and combine. One is relevance of our being, and two, resilience related to that relevance and existence. I guess we'll all agree, and I really would like as much of discussion and opinions as we can, like we often do. Uh, Relevance in old age is essentially one's own subjective opinion as well as assessment of how meaningful has one's existence been in the past and how meaningful is one's existence now. Meaningful for oneself, meaningful for people around that one cares for, meaningful for larger human race, society, community that we live in. There is this one condition of human mind that in old age gets a bit worse or more than a bit worse, which is about romanticizing the past.
Acha.
Society as well as one's own role and contribution. And I thought I must flag that because that's one of the factors that affects the well-being and the psychological status of people in the older age group hugely. Uh, we all have heard, oh यार वो पुराने वक्त का म्यूजिक बढ़िया होता था, मूवीज बढ़िया होती थी, वो साइकिल वाली या दिलीप कुमार वाली देवदास फिर नहीं बन सकती, things of that kind. We can possibly debate about that, but I just want to, for this minute, neutrally flag that while romanticizing the past is a common human condition, and in some cultures more than some other cultures, in old age, in some cultures being at its most pronounced, it doesn't help by and large the psychological well-being. Uh, like all of you know and have been practicing, I'm sure, living in the present and yet respecting the past is something that adds to the one's well-being better. The other psychologically well-recognized fact, or might even say scientific fact, is that there is this paradox of how old age increases rigidity or inflexibility of thought,
Beautiful.
uh, especially in some personality types. Uh, and yet, the need is more for flexibility. As we'll talk about a few things, and Bobby already referred to some of them. Uh, so there is this need for being more flexible, and that we would all in concept and in discussions agree would make one's own well-being a lot easier. And yet, unfortunately, unless one tries specifically, the natural part of aging is to get more and more set in one's own ways and inflexible or rigid. So those are the two things that I thought is important. What's most crucial is self-awareness, and I'll draw your attention to what some of you might already know, but there is this wonderful concept from the 1960s from the field of social psychology that refers to self awareness. Joe Luft and Harry, someone, they came up with this idea, and so that's known as Johari window, just to recall. Now, the thing is that there are these four cells. If you plot on X and Y axis, what is known to me and unknown to me about myself, and what is known to me or unknown to me about me to others, there is this quadrangle, four quadrants that emerge. Fairly easy to understand. One is what is known self, about Bobby, about me, about any one of us, facts or aspects which are known. The second window, which is the hidden self, uh, is for the first important thing to understand what I know about myself that are not known to others. And as we will talk about a bit later, sharing, ventilating, self disclosure can help the hidden self be drawn out. To what extent is one's own decision and comfort? The third part is possibly the most crucial, and I do think so, the blind self. Things about me that are known to others but not known to oneself. And that can come through good friendship, chats, feedback from colleagues, other sources. Uh, for learning all through life and certainly in the later age, uh, being open to revelations about the blind self uh, seems one crucial aspect. And of course, the fourth quadrant of unknown self is really more Freudian. Things about oneself that are unknown to oneself as well as to the others. That's really getting into the black hole of Freudian unconscious at a deeper level. Um, One thing that I thought in relation to self awareness that might really help is this. There are some personality types and traits that actually are more prone to old age depression as well as other disturbances. People who are idealists, who have been perfectionists, who have been successful in the past, actually very often feel disillusioned or dissatisfied with the way the society is going or the world is going. Not just the world around oneself and one's own immediate comfort or otherwise, but larger concerns about human race, society, the nation, world. And that doesn't help because if there is one scientific fact that I have learned in last 30 or 40 years and has been increasingly so is this. If we look at in terms of research, 500 or 5,000 people with depression in older age and trace back to say what was the commonest personality type, it will turn out that obsession personality type is the commonest. Look at the other way around, and if you were to follow people from their 40s and 50s, people with obsessional traits, all those wonderful traits that have helped till now, what is the commonest problem in terms of health issues or well-being that occurs? Is the old age depression. And so, this relationship between traits, which usually proved very useful in productive years of life and in the 30s and 40s and 50s, actually becomes quite an evident, undeniable burden for old age well being, especially avoiding depression. And so, that's one thing that I want to bring on the table and see how all of you feel about it, and see if at all there are experiences about how one has learned, as I claim I'm learning, to be less so. And quite like what our friend Bobby Grewal was saying, there will be, as you will remember, I have mentioned this in the past too, of the three Ds that matter the most in old age, besides the classical conditions of disability, depression, and dementia, there is also the milder versions of those difficulties. For example, there is declining or decreasing ability, all senses, being able to hear, being able to see sharply, being able to locomotive, walk around, run, jog, all senses. The difficulty in old age is often about adjusting to this. And Bobby was hitting the nail on its head when he said, if we can do that, that adds a lot. And similarly, the story for depression and dementia too. Besides the syndrome of depression, which fairly one might say at least by now gets often identified enough and treated. What's much more of a problem is the subsyndromal depression or the symptoms of depression which go unnoticed, undetected, undiagnosed. And I must flag here, uh, much more commonly with physical health problems. Diabetes and depression, post-stroke depression, a whole lot of conditions across systems is something that we all need to remember. And people in the regional community, uh, clients or consumers of health services, as well as physicians, unless careful, they actually miss that comorbidity between physical and mental health. And I must flag here that not only the well-being can improve if you identify the subsyndromal depressive symptoms, but the outcome of the physical health problems actually gets much better if those subsyndromal depressive symptoms are treated with counseling, with support, with medicines, whatever. And the similar is the same story for milder versions of dementia. I don't know how many of us are familiar with, but there is this well-recognized condition. Bobby will tell us more, I guess, today or someday, of what's called mild cognitive impairment. So there is this stage between normal aging and some forgetfulness that might occur as a part of normal senescence and dementia on the other hand. But there can be a state of mild cognitive impairment that might or might not be a forerunner to dementia. Uh, always. I want to briefly on the next two slides mention one of the theories of personality development that I think eminently more acceptable than almost any other, including Freud's. And we can debate that sometime today or sometime. But there was this guy called Eric Erikson who spoke about personality development and disagreed with Freud significantly. And he said, forget the fact that personality development doesn't stop at 5 or even 12 or 18 or 25, but personality development and I prefer to use the term transformation. Personality transformation actually continues through life course. And as you can see, he described 8 stages, most important, the seventh and the eighth. The conflict that Eric Erikson described that might happen, that might lead to destabilization and lack of subjective wellness was in the adult years, if one has been more generative, meaningfully occupied, or stagnant. And depending on that, as Eric Erikson said, to a great extent depends the last stage of over 65, ego integrity versus despair. Now, the point that I want to make here very strongly is this. Eric Erikson, I don't think meant so way, but people often misunderstand this being said, and you might also have this doubt that if by the age stage, if I am into a stage of despair because my earlier stages of development, for whatever reasons, were not really meaningful, if I did not have intimacy and if I was isolated in the 18 to 40 years of age, or if I was stagnant in my productive years of 40 to 65, what can I do about it after 65? Wrong. Like we said, it's also a question of how one assesses one's relevance and one's contribution in the past and in the present. So the point that I want to make, friends, is that to some extent the real life circumstances of earlier stages matter, and yet it's also huge flexibility of how you interpret and assess your own relevance, or each one of us does that. Um, I wanted to just say one more time what Erickson described as favorable and unfavorable outcome of conflicts at later stages, especially. So he said that in that 65 plus years of age, between intimacy versus despair, if one has a favorable outcome, not only one has had meaningful earlier stages, but one also assesses and interprets now at plus 65 more meaningfully, then you have a sense of integrity, fulfillment, willingness, or to face death. Whereas if those earlier stages have not been meaningful and if we continue to, because of the reasons that I mentioned of personality type and depressive state, symptoms or depressive syndrome, then that leads to dissatisfaction with life, despair over prospect of death. The fear of death is, to my mind, really, as our Indian scriptures again describe very differently, related to how you have led your life and how you interpret it, both. To switch gears to the second part that Dr. Bobby Grewal and I thought we must talk about is what's becoming very common, resilience in every context. Uh, in simple words, resilience would mean being able to deal with misfortunes and setbacks of life, and that I don't even need to say this to this elite group. We all know there are always, in young age, adult age, or elderly, having the confidence in your ability to cope with the stresses of life. Now, mark this: one is the ability to cope with stresses of life, but more importantly, resilience is to do with the confidence that you can cope with it.
Wow. Wow.
Differently, ability to respond to adversity or sustain adverse situation, I believe, in three manners. One, coping with adversity meaningfully. Two, bouncing back. And three, leaving no adverse impact, not leaving scars there. नासूर ना बन जाए कोई भी तजुर्बा या कोई नेगेटिव एक्सपीरियंस हो. uh, Technically, what I think of the many definitions that resilience has been described in, what Sisto said is very crucial. In simple words, and relevant to our theme today, the ability to maintain the persistence of one's orientation towards existential purposes. You know, these questions of why am I, what have I done in life, what's the meaning of what life I have led, what's the meaning of human existence. In Sisto's views, is what decides how resilient you are. Um, One question that many of us might have, and I've tried answering that, having had a huge deal of uh, work and interest in the areas of conflict, disaster, and other adverse situations, individual and community, I've tried answering the question here: can resilience be built up or strengthened? Does that happen? Or should they have to accept that, okay, I'm not a very resilient person, or I am very resilient, so I deal with anything? At the micro level of individuals and families, one time or an occasional situational state of adversity requires crisis support intervention, as we all realize. But repetitive adversities actually build a trait benefit of resilience. And so that's why the question being already debated, and I must talk about this if we have time later, is the increasing comfort, increasing luxuries, everything being provided for and taken care of by tech and logistics and AI. Is that really building resilience of us, or especially the younger generation? But that's a different debate. We can do that if we have. At the meso level of large groups and communities, the one-time state is very available, but what's required is basic safety and physiological needs. In the long term, the bonding increases with adversity, and with all adversities, it only gets better. For nations, as you'll all realize, not to get into the Orwellian or any utopian or negative utopian political debate, but one time stress might or might not increase, and that's what happens with man-made disasters. But again, economic situations like a lot of adversities build resilience, and there is in fact this wonderful experiment that somebody did in 1958 to 62, where he put X number of mouses in a situation where he provided everything, every comfort, every need, all luxuries. And believe you me, what happened was that after a few months, the mouses actually became very disinterested, neurotic, and in the end, fighting with each other. So while extreme adversity does not help resilience, nor does extreme comfort and luxury. Uh, Very briefly, just to recap and see if you all have views about this, I will not get into details of this so we all understand. But what are the skills to build resilience? Maintaining optimism, accepting circumstances as they are, a solution oriented approach, very important, if I might flag this. Avoid victim mentality, social networking, positive future planning, and self reflection and self awareness, as we have said. In terms of programs like the one that Dr. Bobby does, and I guess some of you do, some of you others too, for the programmatic sense, you need to really have a multimodal intervention approach. Nurturing strong relationships, taking care of your physical health, I'm sure well enough known with Bobby's guidance, finding and pursuing purpose, embracing change,
जी,
building self confidence, maintaining perspective, developing problem solving skills, pragmatic ones, and learning effective stress management. So those are some of the practical things that I thought I'll bring out. Two specific techniques. One is what was described long ago again. I mean, we know this in many ways, and those of us grew up in the immediate post-independent India, what the country was that time and our society was, we know this. Uh, Stress inoculation training. Now, the Westerners, if one might say, Baum had to actually describe this as a model, stress inoculation training. We all went through this
what is this?
spontaneously.
Please, just दोबारा बोलना, please.
Sorry?
What was this word you said? Stress inoculation.
Stress inoculation, like you do for
Vaccination.
inoculation in general, right? So essentially, what Baum for the Western society in the 70s said was prior stress exposure can induce resilience to later stress. I
Oh,
want to say one more time that our post-independent immediate 50s, 60s, and 70s India naturally gave us this. So if I might be pointed to our specific generation in Indian South Asian context, I don't think we need stress inoculation. But yes, what one might forget, and I do want to say this seriously, is that as our comforts have increased, as our luxuries have compounded, as we have become more and more materially provided, we might lose that
resilience.
ability to deal with stress. And the problem lies where? See,
Please.
is of course, sorry, go on.
No, please.
There's of course this problem importance of I think very crucial at all age groups, certainly again in the context that we are talking about ventilation and catharsis. I want to highlight this for oneself, for friends who you are trying to help, and
Just,
certainly for
just
you.
explain catharsis, sir.
Sir,
Explain.
that's what. Uh, See, ventilation is merely the expression of negative content. Catharsis is the emotional discharge. So, as I'm very fond of citing, you might have a friend or a colleague or your client, if you're a volunteer. Generally, ventilation and catharsis go together, but you can have both and accept that. You might have a client or a neighbor or a friend who will just come and sit with you, kind of cry or shed tears for 10 minutes, say nothing, and go away. That's all right too. Both ventilation and catharsis individually provide huge relief. If they occur together, all the better. Expression of the negative content of whatever one is experiencing or one is processing, as well as the emotional discharge. So, if one can encourage ventilation and catharsis together, wonderful. But please be sure it's okay to have ventilation without catharsis, okay to have catharsis without ventilation, and certainly for extreme situations or preventing self-harming behavior. Uh, Very fond of this example of the pressure cooker. If you all recall, pressure cooker has two mechanisms that actually help it from bursting. A mechanism for regular outlet of steam, and with that regular outlet, there is still an alerting mechanism, wo jo वजन होता है, whistle. And we all, as human beings, and certainly in adverse situations or in elder age included, need to develop this if we do not have this. Can I connect this back to what I was saying earlier? People who have been perfectionists, people who have been idealists, people who have been successful and in higher positions and everything else that goes with it, believe you me, find it much more difficult to do either of these two.
Wow.
That's the problem. So the more successful and more perfectionist one has been in adult age life, the more difficult it becomes in the elder age unless one makes a specific attempt. It doesn't come naturally, unfortunately.
Wow.
Lastly,
वीडियो बंद करना
sir,
ये वाला मेरा वाला
there are these four very well described lifestyle factors for non-communicable diseases, all of health status: diet, physical activity, alcohol, tobacco. one that has been argued for a long time has been level of stress or subjective well-being, quality of life, call it what you want. One that somehow, again, I think with the Western world situation, not so much applicable to us, but then we are beginning to ape them and copy them very well quickly enough. So relevant is the whole issue of loneliness. And as some of you will remember, the WHO in last 5 or 7 years has, in fact, with collective wisdom or otherwise, actually accepted loneliness as one of the biggest risk factors for health not being well. But I want to say here what Albert Camus, the French philosopher, said in two beautiful sentences. And I quote, Albert Camus said, loneliness is the feeling of being alone in a crowd. But more importantly, and I love this, and I tell you this by both experience and technical expertise, if one has some. And I quote, if you feel lonely when you're alone, then you are in bad company. अगर आपको या मुझे अपने आप से अपने आप के साथ रहने में अकेलापन लगे तो मुझे कुछ करना जरूरी है. Why should we all not learn, much as we would like social support, much as we would like all events and emotional exchange and all of that? Why should each one of us not become, and with the changing Indian society and world community, even more necessary, to be comfortable within one's own skin? मैं इसको कहता हूं अलग प्रकार से हिंदी में, जो मैंने लास्ट में लिखा है, अकेलेपन को एकांत में बदल पाना बहुत बड़ी बात है. Turn your loneliness to solitude. And then I realized nothing new. Bhagavad Gita has been saying the same. But then it's so much better when you experience and learn. And I will suggest and request that for all of us, it's never late to try that process of, I have this, I didn't put it down here. I have this wonderful cartoon where on a double-decker bus, there are two people sitting on the two sides of the aisle. One saying, मैं काफी अकेला हूं. The other guy saying, मैं अकेला ही काफी हूं. And that resonates with me completely. And I will only end by recalling again what Swami Vivekananda said. For happiness or contentment, there are just two things required: sense of purpose or existence and hope. And this, to a great extent, friends, is, and this is not too well known, this is not a state that you inherit or life gives you. These are both states that you can maneuver your thoughts to think and feel. That's my last major point. Sense of hope and purpose of life or existence are cognitive methods, thinking patterns that one can modify and improve. Thank you so much.
Beautiful, beautiful. That was not talking, sir. That was poetry.
Thanks, sir.
That was poetry. I think दो तीन चीजें बहुत आपने numbers के बीच में टच कर दी. One was, मैं कॉमनली पूछता हूं सबके बिहाफ पे, आपने बोला कि as people grow, they become less flexible, whereas the requirement is to become more flexible. ये I feel relevance और resilience दोनों के लिए एक की पॉइंट है. मैं दोबारा सबके लिए ये बात कहता हूं कि as we grow, the requirement for becoming flexible increases, but the ability to become flexible goes down.
Thank you, sir.
Now, Dr. Desai,
Sir.
क्या मेरा कसूर है कि मैं लेस फ्लेक्सिबल होता हूं? दूसरा सवाल, क्या मैं गाइडेंस लेके फ्लेक्सिबिलिटी बढ़ा सकता हूं?
पहला सवाल, कसूर कतई नहीं है. ये शायद थोड़ी बदनसीबी ज्यादा कैसा, तो इत्तेफाक की बात है कि साइकोबायोलॉजिकली वन इज नॉट मेड वेरी फ्लेक्सिबल. And I want to highlight this. This is not known 40 or 50 years ago too well. A whole lot of traits, besides all the earlier experiences and parenting and sanskar, which remain important, to a great extent, personality traits are also psychobiologically determined.
Okay.
Genetically determined. So, कसूर कतई नहीं है. लेकिन हाँ, अगर थोड़ी सी बदनसीबी या इल्लत है भी कि आप या मैं लेस फ्लेक्सिबल रहे पहले अंतराल में, तो उसको चेंज करना, मॉडिफाई करना न सिर्फ हमारा जिम्मा है, लेकिन सरलता से संभव है, नॉट ओनली काउंसलिंग से दोस्त, बट इवन विद वंस ओन एफर्ट.
वो क्या?
खुद को हमें याद दिलाना पड़ेगा ना कि भाई दुनिया, जैसे हम बच्चों की ट्रेनिंग में क्या करते हैं, आई मीन पेरेंटिंग स्किल्स में, कि यार बच्चे को थोड़ी तकलीफ दीजिए, थोड़ा एडवर्सिटी होने दीजिए, हर चीज मत मान लीजिए। क्यों? क्योंकि जैसा आज आप परिवार में सब चीज मांग के दे रहे हो, मांगने पर वो दुनिया नहीं देगी।
दुनिया ने।
तो जो पेरेंटिंग स्किल्स में एक इंपॉर्टेंट प्रिंसिपल है, वो सिर्फ अपने आप को याद दिलाना जरूरी है ना,
बहुत।
कि
आई
भाई
थिंक
हो सकता है मैं एमडी था, हो सकता है मैं फला पोजीशन पे था, तो वहां सब कुछ मेरी मर्जी के मुताबिक होता था। वो अब जरूरी नहीं है कि जीवन में हो, बल्कि नहीं होता।
नहीं होता। आई थिंक ऑल ऑफ अस, प्लीज ऑल एल्डर्स रिमेंबर, आपके घरों में ये बहुत कॉमन लाइन सुनाई देगी। आजकल ना माता जी बड़े अड़ब हो गए हैं। आजकल पिताजी हमारी बात नहीं मानते। हियर कम्स द इशू वेयर इट ट्रिगर्स ऑफ रेजिलियंस कम होना एंड रेलेवेंस कम हो जाना। क्योंकि डॉक्टर देसाई, मुझे बार बार कहा जाए कि बड़े अड़ब हैं, बड़े अड़ब हैं, विल आई नॉट स्टार्ट टेलिंग माई सेल्फ कि यार तू ही बिल्कुल बेकार है।
दैट्स ट्रू, दैट्स ट्रू,
हाँ,
आई एग्री, आई
वहां
एग्री।
से रेलेवेंस कम होने से रेजिलियंस का रोल आ जाएगा।
एक्चुअली बात सही है, एंड आई डिडंट टच अपॉन दैट कनेक्ट जो आपने हमने बात की थी, जब हमने टॉपिक को डिसाइड किया। आई थिंक यू एंड आई बोथ हैड इट इन माइंड, आई डोंट थिंक वी सेड इट। रेलेवेंस अगर कम हो भी रही है, तो रेलेवेंस जैसे कम होती जाए, रेजिलियंस की जरूरत और ज्यादा है ना।
ज्यादा बढ़, बिल्कुल, बिल्कुल।
तो वो हम लोग अगर कर पाए, एंड that's a psychological readjustment, recalibration that we all need to make.
सो आई थिंक
And
डॉक्टर,
but my sorry,
एक
my
बात।
major message is sorry, my major message, those is that, and now I can tell you this by experience. If you had asked me 10 or 15 years ago, 20 years ago, I would have said it theoretically. When I was 45 or 50, I would have said yes, it should be done. Now I can say it with some confidence, not complete success at all, but with some confidence that yes, it's possible to do so. विज्ञान जो कहता है कि अपने विचारों को और विचारों की पद्धति को हम बदल सकते हैं ओल्ड एज में भी,
में भी।
ये बात है।
बस, आई थिंक ये सबसे बड़ा मैसेज डॉक्टर देसाई दे रहे हैं। ये कतई कभी मत कहना इस उम्र में मैं बदल नहीं सकता।
हाँ हाँ।
दिस इज द बिगेस्ट चैलेंज। स्टॉप सेइंग दैट। डॉक्टर देसाई हैज यूज, एक लाइन बोली उन्होंने कि पर्सनालिटी डेवलपमेंट बच्चों तक नहीं सीमित। आपके अंदर भी पर्सनालिटी डेवलपमेंट हो रही है, आपके सर्कमस्टेंसेस बदल रहे हैं। आपको अगर एक्सेप्ट करना भूल जाएंगे। मैं तो जी 40 साल से ना सुबह 9 बजे ही नाश्ता खाता हूं। भाई साहब,
हम्म,
वो 9 बजे इसलिए खाते थे क्योंकि 9:15 बजे दफ्तर पहुंचते थे।
हाँ, correct,
सो रीजनिंग, एंड
yeah.
लेट मी टेल यू, एज डॉक्टर देसाई सेइंग, डे टू डे हम एक्सपीरियंस देखते हैं। More than 50% conflicts in home with the elders and younger generation is only because of this reason. They stick to their statement. मैंने ऐसे ही करना है, मैंने दवाई खाली पेट नहीं खानी। और हम दवाई दे रहे हैं जो खाली पेट देनी होती है, दवाई गर्म है। So therefore, the issue today, Dr. Desai, is everybody wants to live to 100. Are you going to live? जो मैं वर्ड एक्सप्लेन करना चाहूंगा, आपसे रिक्वेस्ट करूंगा। एक स्टेज आती है कि मैं समझ रहा हूं कि मैं थोड़ा अड़ब हूं, मैं सेल्फ पिटी में चला जाता हूं। ऐसा ही हूं, जमाना अब तो यही जमाना है, अब तो गालियां ही खानी है।
हम्म
इज सेल्फ पिटी अ पर्सनैलिटी ट्रेट और ए आउटकम of a failure in resilience?
like most traits, कुछ हद तक पर्सनालिटी का इशू से भी पहले है। इट बिकम्स अ पार्ट ऑफ डिप्राइवेशन सिचुएशन। तो भाई मेरे पास 3 गाड़ियां थी, 4 नौकर थे, पूरा ऑफिस खड़े रहता था जी हजूरी करते हुए। अब कोई नहीं है, घर पे एक नौकर है, घर के लोग सब स्कूल और ऑफिस चले जाते हैं। तो कुछ हद तक चेंजिंग लाइफ सर्कमस्टेंसेस का माहौल है। कुछ हद तक पर्सनालिटी हो, बट इट्स लार्जली a part of depressive symptom or syndrome. And before it reaches there, आप और हम जो कहना चाह रहे हैं, I think if our colleagues consider and see how they feel and agree or disagree, more than welcome to express. To a huge extent it's modifiable. दिक्कत ये है, और आज मैंने, जैसे आप महसूस करेंगे, आज मैंने क्लिनिकल इश्यूज को अवॉइड किया.
बिल्कुल
डिप्रेशन ये होता है, डिप्रेशन ये है, we can always talk about it today or any other time. I am sure you have arranged a lot of talks on clinical condition. वो क्लिनिकल कंडीशन पे पहुंच जाए उससे पहले हम उसको मॉडिफाई कर लें. अगर बायोलॉजिकल डिजीज मुझे डिप्रेशन की होनी है तो होनी है, उसका इलाज करवाना पड़ेगा.
उसका इलाज कराना. That's right.
हाँ, उसका इलाज जरूर कराएं. हाँ.
You see, now I'll illustrate एक एग्जांपल देता हूं सबको. अभी डॉक्टर देसाई ने बोला पहले मेरे पास सब चीज नौकर चाकर थे, अब मैं अकेला हूं. I remember a day, Dr. Desai, धौलकुआ in the Defense Services Club में, Field Marshal Manekshaw walking inside, and he walked inside, and वहां पे फौजी वो शूज साफ करते हैं. There, and एक वो शूज क्लीनर था. तो अपने आप मुड़ के कहता है सबको, you see, days have changed. I don't have somebody to tie my laces, so I'm wearing shoes without laces. अब हंस के बोला, पर मुझे आज तक वो चीज याद है कि आफ्टर ऑल मानिकशॉ जैसा अपराइट मिलिट्री मैन, उसके जहन में ये बात जरूरी आई कि मैं बगैर लेस के शूज पहन के क्लब में आ रहा हूं.
But I would also say good adaptation, right?
Yes, that is what I'm saying.
बड़ी इत्तेफाक की बात है आप जो कह रहे हो, सॉरी अलाउ मी, बड़ी इत्तेफाक की बात है. आईआईसी इंडिया इंटरनेशनल सेंटर में मैं पहले बहुत जाता, अब तो बहुत जाता हूँ. नाउ ही इज नो मोर, बट वेरी सिमिलर. मार्शल ऑफ द इंडियन एयरफोर्स लाइक फील्ड मार्शल Manekshaw was only one, Arjun Singh.
जी.
And it so happened I had met Arjun Singh during my boarding school, and so I have followed him and known him since then. 65 war se, 71 war se. This gentleman, again, like you said, that simplicity for adaptation.
Yes.
He would get down from his car, one chap will escort him to the library, he'll sit there, read for a while, walk back alone. So I agree with you. Manekshaw, by a hearsay, and Marshal of the Indian Air Force.
They are samples of adaptation. They are samples of resilience. मैंने इनका नाम लिया. So I think that's important. Would anybody please be wanting to ask a question from Dr. Desai or express?
More importantly, comment, share.
Any comments, please?
Share experiences.
Yes, Avinash ji, please go ahead.
मुझे तो ऐसा लगा है कि जैसे वो जो हम ज्ञान सुनते हैं ना, ब्रह्म ज्ञान, उसको साइंटिफिक वे में बता दिया इन्होंने.
बहुत अच्छे, क्या
बहुत तो अच्छा. I was really enjoying. Hi,
Avinash ji, what a lovely synopsis of the whole process. बिल्कुल. अब देखिए ये there was a reason why I invited a person of his stature on International Oldest Day कि there is, ये सेपरेट करने की जरूरत नहीं. अविनाश जी बहुत बहुत बड़ी अच्छी बात कही कि साइंस इज टीचिंग यू हाउ टू बी रेजिलिएंट एंड रेलेवेंट. सिर्फ माला पकड़ के रेलेवेंस
नहीं, लेकिन हम यही सीख रहे हैं. गीता भी यही सिखाती है. जीवन में जीवन कैसे जीना है, वैसे आखिर तक कैसे जीना है. खाली शुरू में नहीं, जब सब कुछ है तब नहीं, जब सब कुछ नहीं है तब भी कैसे जीना है, कितनी उससे ताकत से जीना है. वो बात ये अब सिखा रहे हैं हमको, इसमें यही सिखा रहे हैं. अच्छा, एक मैं पूछना चाहती हूँ, एक लाइन इन्होंने बोली थी, मैं अकेला ही काफी हूँ. उससे पहले की लाइन क्या थी?
वो तो ये दो बंदे जो बस में डबल डेकर पे ऊपर बैठे थे एक तरफ, एक कहता है मैं काफी अकेला हूँ.
अच्छा.
दूसरा कहता है मैं अकेला ही काफी
हूँ.
ब्यूटीफुल लाइन, बहुत ही ब्यूटीफुल लाइन है.
बहुत ब्यूटीफुल.
मैं काफी अकेला हूँ, मैं अकेला ही काफी हूँ.
हाँ,
बहुत बढ़िया.
वो ये ना, लोनलीनेस को चेंज करना एकांत में.
बहुत ही. Anybody else, please? Dr. Shahi, you're muted, ma'am. You're muted.
हाँ सर, बहुत अच्छा लगा. मैं ना काफी एंजॉय किया और लगा कि हाउ टू apply and, be with whatever you have and how to go on and on, Very good.
And let me tell you, let me share with all of you. आप लोग अभी मेरे हिसाब से, प्लीज डू नॉट टेक मी एज रॉन्ग और जजमेंटल, लेकिन मेरी ऑब्जर्वेशन है कि आप सबको, जितना आप आज की तारीख में कम्युनिकेटिव हैं, उससे कम से कम नहीं तो 25% और कम्युनिकेटिव होना चाहिए, कम से कम। ऑल ऑफ यू लेट मी से दैट दिस इज एन ऑब्जर्वेशन आई मेड, कि जितना आप कम्युनिकेटिव होंगे उतना आप रिजिड कम होंगे, उतना आप फ्लेक्सिबल ज्यादा होंगे, और आने वाले समय में यू हैव टू बी फ्लेक्सिबल। आप देखिए डॉक्टर देसाई, हाउ मेनी एल्डर्स रीच ए कैजुअलिटी में पहुंच के वो कहते हैं हमने जी आपका ब्लड लेना टेस्ट के लिए, नहीं मेरा सारा खून निकाल देंगे। दे रेजिस्ट इवन ए ब्लड टेस्ट, सारी उम्र कराए हैं, बट दे सडनली बिकम वेरी रिजिड। एंड दिस डज नॉट मीन डॉक्टर देसाई ने वार्निंग दिया लास्ट लाइन में, कि अगर कोई एल्डर को ऑर्गेनिक बीमारी है जैसे कि डिप्रेशन है, वो अलग से इलाज होगा उसका। ये जो फीचर्स अभी बोले हैं, ये उनके लिए है जिनको कोई बीमारी नहीं है। बीमारी होगी तो कॉम्प्लिकेट हो जाएगा, दैट इज इंपॉर्टेंट। जी गुप्ता जी, आप कुछ कह रहे थे? हाँ, आप म्यूटेड है गुप्ता जी। जी
सर मैं एक्चुअली सॉरी, जितना कुछ भी मैंने सुना।
आपकी आवाज कट गई।
अब आ रही है?
नहीं, अभी नहीं, पूरी नहीं आई।
कैन यू लिसन मी नाउ?
हाँ, अभी आया।
मैं ये कह रहा था, आई ज्वाइंट लेट, आई मिस द मोस्ट पार्ट ऑफ इट, बट वट एवर आई लिसन, इतना पॉजिटिव नोट लगा मुझे आज का, कि दैट आई एम सॉरी टू मिस द रेस्ट पार्ट ऑफ इट।
कोई बात नहीं, मैंने रिकॉर्डिंग है, आपको भेज दूंगा।
लेकिन आपके जो 2 मैसेज है ना डॉक्टर साहब, लास्ट के 2 मैसेज हैं, वही काफी हैं एक पॉजिटिव जीवन को जीने के लिए। And I'm really learned a lot.
So nice.
Hats
Dr.
off.
Dr. Mudgil sir, अनम्यूट कर लीजिए प्लीज। अभी अनम्यूट नहीं हुए। ये भी एक साइकोलॉजिकल मैजिक।
अच्छा, नहीं राइट, बिकॉज उस पहले अनम्यूट थे तो नहीं सुनाई दिया होगा। नहीं, दिस वाज रियली वेरी नाइस टॉक, एंड many things we knew, but still repetition, I mean revising the same things and learning something new is always good. So thank you so much for calling him.
It's a pleasure. So anyway, so I think
and very good topic, Dr. Saab. Very good, very relevant topic.
Yes, इसी के बेसिस पे 100 साल चलेंगे आप। गोयल साहब, आज आपका सवाल नहीं आया। गोयल साहब इज बिजी टुडे। नहीं, उनका वीडियो नहीं चल रहा।
Hello, Dr. Grewal. Can I ask something?
Please, Dr. Vahi, please go ahead.
Yeah, though we know that, regrets of the past are of no use and we can't change the past, but still it sort of troubles us. We keep repenting why we did this, that, and reminiscing, as he said. How to stop that chatter of the past?
Beautiful. Very good question. Very good question.
Diversion is a good technique.
Which one?
Psychologically, diversion is a good technique. तो अगर हमारा मन हम कहीं डाइवर्ट कर सके, किसी और मीनिंगफुल टास्क में, विचार में डाल सके, तो अच्छी बात है. Externalization of interest is a good idea. Again, within the condition, gardening हो, cooking हो, merely household work हो. बट मुझे विचार ये भी है आपके मैम कहने से कि जैसे डॉक्टर साहब ने, हमने डॉक्टर ग्रेवल ने हमने कहा, जैसे डिप्रेशन में सच है, वही यहाँ भी सच है कि वो जो एक क्लिनिकल कंडीशन है ना ओसीडी की, भाई मेरे विचार और मेरी भावनाएं, मेरी पीड़ा शायद मेरे बस में नहीं रहती, So if any one of us feels that despite my best effort, I'm not able to control those repetitive thoughts, it's worth a consultation, because
Very,
वो easily दवाइयों से treat हो जाएगा.
very good, very good.
Okay.
Dr.
Okay.
Bhai, and for everybody, please, for everybody, यहां तक कोशिश मत करिए कि आपकी कोशिश ही टूट जाए. ऐसा मत करिए.
Very nice.
कोशिश को मत तोड़िए. कोशिश बहुत ही डेलिकेट धागा है. तो अगर आप कोशिश कर रहे हैं लेकिन कामयाब नहीं हो रहे, what Dr. Desai has very clearly mentioned, he's the expert, it is worth taking the consultation. का मतलब क्या हुआ? It is means कि दवाई लेनी चाहिए.
I understand.
अब बात यह है कि लोग कहते हैं इसमें क्या दवाई है? What Dr. Desai, clarify this please. OCD, what does OCD mean in a day-to-day life? OCD का थोड़ा सा प्लीज एक्सप्लेन कर दीजिए.
Sure. कॉमनेस हम सबने जीवन में देखे ना, आप देखे जो ब्रॉडली दो डिस्क्राइब्ड है ना लिटरेचर में भी, वॉशर्स एंड चेकर्स. भाई एक सबसे कॉमन सिम्टम होता है कि मेरे हाथ गंदे रह गए, तो मैं जाके 50-100 बार, हमने ऐसे ही मरीज देखे जो 500 बार दिन में हाथ धो रहे हैं साबुन से. इस हद तक की स्किन के 2 लेयर्स उखड़ गए. राइट. तो वॉशर्स और चेकर्स. मैं ताला बंद किया लेकिन कॉरिडोर में चलते हुए ध्यान आ गया शायद ताला बंद नहीं हुआ, तो मैं जाके फिर चेक कर लेता हूँ. अब 1-2 बार हो ठीक है, 50 बार 40 बार हो रहा है तो गड़बड़ है. उसी प्रकार ये जो विचार है किसी रिश्ते के बारे में, माफ कीजिए, जैसे मुन्ना भाई में सही दिखा है, एज कोई सरोकार जरूरी नहीं दिल के मामलों से. हमारी पुरानी प्रियतम याद आ रही है, कोई बच्चे याद आ रहे हैं, कोई लॉस हो गया वो याद आ रहा है. कोई भी रिपीटेटिव थॉट या इमेजरी या आइडिया जो मैं जानता हूं कि रैशनल नहीं है लेकिन मैं उनको रोक नहीं पा रहा हूं, वो हो गया ऑब्सेशन. सर, ऑब्सेशन के साथ जो मैंने वॉशर्स और चेकर में डिस्क्राइब किया, वो जो चेकिंग बिहेवियर है या वॉशिंग, वो हो गया कंपल्शन. तो ओसीडी जो है, ऑब्सेसिव कंपल्सिव डिसऑर्डर, वो अक्सर पहचाना नहीं जाता. इनफैक्ट इफ आई माइट से, एक नाजुक मुद्दा टच करूं, हमने सबने खुद बहुत मरीज देखे और ये हमारे कल्चर में थोड़ा नाजुक है. रिलीजियन, पूजा, अर्चना, कीर्तन, ये सारी जो रिचुअल्स हैं, they also can become part of OCD if it is in excess.
Beautiful.
तो ये जरा गौर रखना पड़ेगा.
बहुत बढ़िया.
नहीं जी, मैं तो ओल्ड एज में बड़ा सही कर रहा हूँ, दिन में 10 घंटे बस एंजॉय कर रहा हूँ.
यस, दिस इज ए, और बहुत अच्छी बात लेके आए डॉक्टर देसाई आज, कि एल्डर जो है वो बिलीव करना शुरू कर देते हैं कि मेरे को 2 घंटे सुबह पूजा करने में मेरा भला होगा. एंड इट इज बेसिकली द ऑब्सेसिव पार्ट ऑफ देयर्स. अपनी दवाई भूल जाएंगे, बाहर जाना नहीं जाना जाएंगे, लेकिन नहीं जी मैंने 2 घंटे पूजा करनी है. What Dr. Desai said, it's a very sensitive issue. तो लोग कहेंगे जी आप तो पूजा के लिए भी मना कर रहे हैं. क्या है, एक बहुत पतला सी लाइन है बिटवीन डूइंग पूजा फॉर एलिवेटिंग योरसेल्फ वर्सेस पूजा फॉर ऑब्सेशन. दैट इज द डिफरेंस दैट हैज टू बी कॉट. और उन्होंने कहा पकड़े नहीं जाते. सो आई थिंक लेट्स सेंड ए क्लियर मैसेज फ्रॉम डॉक्टर देसाई कि अगर उन्होंने कहा कि पास्ट की चीजें याद कर करके, गोलगप्पे मैंने बंगाली मार्केट में खाए, बहुत अच्छे थे, आज के गोलगप्पे खाने बेकार हैं. इट डज नॉट हेल्प. बट इफ यू कीप रिजेक्टिंग द प्रेजेंट डे गोलगप्पास, यू नीड टू गेट ट्रीटमेंट बिकॉज इट इज एन ऑब्सेशन. इतना आसान नहीं है.
कुछ हद तक ये नॉर्मल ह्यूमन टेंडेंसी, मुझे याद आ रहा है हंसी मजाक में, कि इसीलिए ओल्ड दिल्ली वाले करीम की 10 दुकानें खुल गई हैं. पुराने दही बल्ले वाले नोएडा में खुल गए, वहां बोर्ड पे लिखा रहता पुरानी दिल्ली वाले.
ताकि वो यादाश्त वाले
नॉर्मल और एबनॉर्मल में बड़ा थिन लाइन है. सो इट्स फाइन, इट्स ओके. मुझे अपने गांव की याद आती है, मुझे वही फील चाहिए. मुझे ओल्ड दिल्ली की याद आती है तो मैं वही खाना चाहता हूँ, परफेक्टली ऑल राइट। अगर वो एक्सेस हो जाए तो जरा सावधान हो जाइए।
That's it. I think Dr. Desai, you touched many सितार की कई तारें आज आपने हिला दी, और आई होप के सबके तारें हिली हैं ये सोच के कि फ्लेक्सिबिलिटी आपको जरूरत है, लेकिन फ्लेक्सिबल इन वजह से, जो वजह डॉक्टर देसाई ने इन्यूमरेट की, इन वजह से फ्लेक्सिबल एल्डर्स होना कम कर देते हैं. So it is a paradox. So learn how to be flexible. It is possible. So I think first and foremost, let's give a big hand to Dr. Desai.
Sure.
He's away for a very important meeting in Ahmedabad. Despite that, दोस्त आपने टाइम लिया,
अरे सर,
हमारी रेजिलियंस और हमारा रेलेवेंस आपने बढ़ा दिया. Thank you so much. Thank you so much.
सर, नमस्कार आप सबको, प्रणाम.
Thank you, sir.
And
Pranam,
before
sir.
we
Thanks.
say goodbye,
Thank you, Dr. Desai.
may I request all of us to jointly say and commit to Dr. Desai कि हम अपना ख्याल
हम
रखेंगे.
करेंगे.
सब मिलके कहिए, मेरा
मेरा
स्वास्थ्य
स्वास्थ्य
मेरे
मेरे हाथ,
मेरा स्वास्थ्य
मेरा स्वास्थ्य मेरे हाथ,
मेरा स्वास्थ्य मेरे हाथ.
Thank you so much.
Right, sir.
Dr. Desai, we are getting comments from all over on the great effort that you put in. Thank you so